Hi everyone, welcome to today's video. I'm Mary Felling, physical therapist, and today I'm going to show you an easy technique to help with TMJ problems. This technique is really great if you have problems with chewing, yawning, or talking, if you're having pain in general, or if you have clicking and popping. All you need is one finger. All right, let's get started. Just before we begin, if you're somebody who has had problems with your jaw dislocating, or you're currently having problems with your jaw dislocating, this is not for you. Also, if you're somebody who can't open the mouth all the way or has trouble getting your mouth all the way closed so that you're not able to get your teeth together, this is not for you. You would want to talk to your physical therapist first before starting this. Okay, for everybody else, all you need is a finger, and I'm going to start with just showing you where the TMJ is located. TMJ means temporal mandibular joint. Temporal bone, the mandible top part, and where they meet is called the TMJ. So you're going to take your fingers, you're going to put them on the front of your face, you're going to find that cheekbone, and then just very slowly you're going to follow the cheekbone back along its ridge right to where it ends in front of the ear. And from there, drop your fingertips underneath and you're on your TMJ. You can even open and close a little bit and you can feel the jaw working. So what we're going to work on specifically in the TMJ is a muscle called the pterygoid. The pterygoids, you have them on both sides, and there's two sets of them, and they're very responsible, and they play a big part and impact TMJ pain and dysfunction. They're the muscles that helps to grind our food, but they can get very tight and restricted for all kinds of reasons. Tension, just having psychological, emotional tension in your life for prolonged periods of time, but they can also get very, very tight from stress patterns coming up from your neck and stress and strain patterns coming up from your shoulders. So we're going to go in local though today. So this is what it looks like. I'm going to take my finger and I'm going to work on my right pterygoids. You just put your finger up on your gum line and you follow the gum line all the way back behind that last tooth. There's like a little cavern there, and you turn your finger away. So what's happening is the pad of your finger is out and it's facing your skin. So the nail of your finger is next to your gum line, and just gently poke around in there gently, and you'll find a tender or a tight area, and you're on the pterygoid. And so we're going to do a myofascial release technique with that. So we're going to start our clock. Now, when you're in here, if you have long fingernails, what you want to do is use some other kind of an instrument, obviously not your finger. Maybe use the opposite end of a toothbrush. It's rounded. You can use that, something similar. And when you are on that spot, you don't have to push hard. You don't have to move around at all. All you're doing is maintaining pressure in there. Now, one of the other ways you're on the right spot, so you guys keep your finger on your pterygoids. I'm going to take my finger out here for a minute so I can continue to talk to you a little bit. The way you know you're on a pterygoid is because when you've put your finger along the gum line and have gone all the way back, your finger is pointing to that TMJ joint that we found. So you're kind of at an angle. You're at an angle like this inside your mouth. So I'm not going this way with it. I'm just pointed up a little to in front of the ear. All right. So while you're there, you're on the pterygoid, and what we're doing is we're using mechanical energy of compression in the mouth on the pterygoid to help elicit the piezoelectric effect. So if you remember in the John Barnes style of myofascial release, we need a minimum of 5 minutes of mechanical energy, whether that's compression, which you're using right now, or elongation or twisting, to help elicit this bioelectric flow in the body. It's called the piezoelectric effect. And that piezoelectric effect happens to move right along the fascia. The fascia is like the copper wire in the body. And when the fascia comes to an area where there are myofascial restrictions, myo means muscle, fascia is the connective tissue, that big cobweb of sinewy tissue that surrounds and infuses everything, and that includes the muscles. When that mechanical energy gets to that spot, it helps it to start softening and relaxing, and it rehydrates. Yes, tissue like your muscle and your fascia will dehydrate when they become so spasmed and tightened down and cause pain. So as that electrical flow moves and starts helping that myofascial restriction back in the pterygoids to release, there's less pain and more mobility. So this does help. It will help with lessening the clicking and popping because your jaw can move in its natural position. All right, so you're staying in that position. And I do want to remind you, you don't have to stop at 5 minutes. We will for today's purposes, but you can continue past 5 minutes. You can go to 7, 8, 9 minutes. It won't hurt. You'll just get more and more releases. This technique you want to do, like all techniques, make sure you do them 14 days in a row, minimum, because you need a continuous presence of rehab on tissues so that there's a thing called a tissue restriction or tissue memory. So you're working on it now and you're going to get some softening, but then it starts tightening back up again. Well, before it can tighten all the way up again, tomorrow you're back in there, softening it, bringing it back towards its normal elasticity and length. And after 14 days, what happens is you'll get more permanency to its natural length. And then after that, you can just do this technique maybe every second or third day. For those of you who feel really tight and it's very easy for your jaw to tighten up again, do this technique before and after each meal. If you don't have the time to do it before and after each meal, at least do it after each meal from all the tension that will build up from eating and chewing. All right, so once you're in there and we're in our last minute now, you might feel some symptoms going other places, maybe even to your ear. That's okay. You might feel it in your neck a little. That's just telling you that there's tension and that muscle is so tight it's been creating tension to other places around it. No problem. You haven't hurt yourself. And also, these tissues inside our mouth, these membranes are very delicate. So if you know that you have a dried out mouth, if you know it's easy for your tissues to split, you have to be very gentle because you don't want to bleed. Don't want to cause another problem. All right, so we're coming up to the end of that 5 minutes. For some of you want to continue, that's fine. Otherwise, slowly bring your finger out, or if you're using the bottom of a toothbrush, bring your finger out, and then you would go to the other side. The jaw is the only bilateral joint in our body. Bilateral means both sides have to work together to work normally. So you do want to make sure you're taking care of the other side. Even if the other side isn't popping, it can still be very tight and be part of the problem of TMJ and pain and clicking. All right, thank you so much for joining me today. I'm so glad you're taking care of yourself, showing up for yourself, because that's where change starts. That's where transformation begins. If you enjoy learning how to take care of yourself, I invite you to subscribe to my channel. You'll be alerted every time a new video is uploaded, so you can continue taking care of yourself and enjoy that pain-free lifestyle that you deserve. Thanks for joining. I'll see you on the next video.